Have you ever wondered how easily those tiny, invisible flu viruses manage to spread from person to person, especially during flu season? Flu viruses primarily transmit through respiratory droplets, which are tiny particles that travel through the air when an infected person coughs, sneezes, or even talks. These droplets can then land directly on the mouths or noses of people nearby, or they can settle onto surfaces around them. The main reason for this rapid spread lies in the nature of these respiratory droplets. When someone with the flu coughs or sneezes, they can expel thousands of microscopic droplets into the air. These droplets typically travel about 6 feet before falling to the ground or onto nearby objects. If you are standing close to an infected individual, you can directly inhale these virus-laden droplets. Another significant way flu spreads is through indirect contact, where these droplets contaminate surfaces, known as fomites, such as doorknobs, phones, or countertops. When a healthy person touches these contaminated surfaces and then touches their own eyes, nose, or mouth, the virus can enter their body. To help prevent flu transmission, practice good respiratory hygiene by always covering your mouth and nose with a tissue when you cough or sneeze, then immediately throwing the tissue away. If you do not have a tissue, cough or sneeze into your upper sleeve or elbow, not into your hands. Frequent and thorough hand washing with soap and water for at least 20 seconds is also crucial, especially after coughing, sneezing, or being in public. Try to avoid touching your eyes, nose, and mouth, as this is how germs often spread from your hands into your body. A key factor in flu transmission is that people can be contagious even before they show symptoms, sometimes starting 1 day before symptoms appear and lasting 4, 5 to 7 days after becoming sick. This period is called the infectious period. Also, some people with the flu may not develop any symptoms at all but can still spread the virus, which is known as asymptomatic transmission. These details highlight why prevention efforts are so important for everyone. Understanding these primary transmission routes empowers you to take simple yet powerful actions. By consistently following recommended hygiene practices and avoiding close contact with sick individuals, you significantly reduce the chances of both catching and spreading flu viruses, protecting not just yourself but also your loved ones and your community.